I'm Ishwari. I'm a final year medical student. I did my telemedicine rotation in April in internal medicine. Ever since, I've been receiving a lot of questions regarding this. So, in this video, I'm going to answer the most frequently asked questions regarding telemedicine and also provide quick tips for you to make the most of your rotation. If you're applying for the match this year and don't have enough LORs or enough clinical experience in the US, I'd suggest you to do the telemedicine rotation before applying. But if you're applying for the match next year or the year after that, I'd recommend you to wait until November 2020. This is because a lot of people who are applying this year will try to get a rotation before October in order to get the required credentials for this year's match. And since as of today there are very few hospitals which are offering this rotation, it can get quite crowded. So after November, there will be fewer people and your waiting time will be lesser too. Although this isn't a requirement for most rotations, I personally feel it would be better. Thing is, a telemedicine is different from an observership. At least the one which I did involved a lot of discussions in order to get to a diagnosis and organizing a treatment plan, and we did deal with some rare cases as well. One shouldn't feel left out when a discussion is going on without having much to contribute. So, in my opinion, once you've completed your step one, you know your basics are strong for sure, and it will definitely help you participate and understand what exactly is going on. Since I was one of the first people to do a telemedicine rotation, I didn't know what exactly to expect. So all I did was go through my internal medicine notes and my flashcards, and I went through a little bit of basic history taking and physical examination. But right now, if you're starting it, I'd suggest you to just focus on your basics and you're good to go. This wasn't a question that was asked to me, but I feel it's important for you all to know, and that's why I put it in here. Firstly, it's important to check whether there's a university affiliation with the hospital that you're rotating in, because a letterhead from a university affiliated hospital will hold a greater weightage. If you want to know more about university affiliations, please check this video out. Most rotations provide an unwaived LOR. Now, an unwaived LOR is basically like a standard format where most of the doctors might just ask you to write it and you write it and they just sign it for you. This does not hold a lot of weightage when it comes to your residency. So do request your preceptor to provide you a waived LOR. So this is the kind of LOR which you would not be able to see, but your preceptor will upload it directly to ERIS. A program director has discussed more about waived and unwaived LORs in this video, so do check it out. A personalized LOR is always better than a generic one. In order to get a good personalized LOR, you need to create a great impression. So here are 5 quick tips to do so. Whenever someone from your team is answering a question and you happen to know the right answer, you might be very excited to speak, but do not interrupt them. Everyone will be given a chance and you should politely wait until your turn so that you can speak and express what you have to say. A lot of the things that I learned from this rotation came from observing and listening. The way my doctor and my peers talked to patients, the way they expressed themselves, the way they conducted themselves, as well as the way they approached cases. So keep your eyes and ears wide open. Remember that this isn't a competition. Clinical rotations involves a lot of discussion and teamwork. Keep in mind that the people you'd be rotating with are at different stages of their careers. Some might have been a doctor for the past 10 years, while some might still be in med school. So if someone makes a mistake, take a step back and explain to them what they're missing without making them feel bad. This will create a great impression on your preceptor and it would also make you very approachable. Remember that it's not about being the best, but it's about being the best version of yourself. Like I mentioned, this isn't an observership. So, whenever someone asks you a question, don't hesitate to answer and don't shy away from giving your opinion on a case. The doctor I rotated with always told me that it's okay to give a wrong answer, but it's definitely not okay to not answer at all. I have to admit that it can be very intimidating in the start, but when you keep answering and doing things in tiny bits in your first week, by the time you're into your second week, you'll be really comfortable and way more confident. And this has really changed the way I look at my career. Build a healthy relationship with your peers and your preceptor. Stay in touch with them even after the rotation is over. Because we're all in this journey together and we can always support each other. Apart from these 5 tips, I'd like to tell you that never forget to be punctual, dress well, and have good lighting. I want to conclude by saying that don't look at it as just an opportunity to get an LOR and just check the whole USCE box off your list. Instead, enjoy the whole process and you'll realize that there's a lot to learn. I did a Q&A session with a program director and an internist a few weeks back. If you're applying for residency in the US, do check these videos out. I hope this video was helpful. Please give it a thumbs up and comment below to show me your support. And subscribe to my channel for more medical videos, quizzes, and be a part of my med journey. Thank you.